There I am, finally. Yes, welcome back, everybody. Now we are going to proceed to the next item on the agenda, which is the second panel discussion of the day on the smart hospitals and innovative digital healthcare delivery. As with various technology trends such as cloud, cybersecurity, the IoT, big data, artificial intelligence, and so much more. What is all of this, and what is going to be the next step in the healthcare industry? Our panelists for this session are Dr. Vijay Raghavan, who is from PwC, director at PwC India, Digital Health Section. We have Neil Mehta from the Healthcare Futurist Adani Group. We also have Shiv Kumar Pramanik, who is the CIO of Columbia Asia Hospitals. Our regular attendee, Neeraj Lal, who's the Group Senior Vice President of Medicover Hospital India. And of course, the moderator for this discussion is Rajiv Shika, who is the CIO of Vedanta, the Medicity Hospital. Gentlemen, the stage is yours. Kindly take it away. We're all ears, and we want to know what is the latest technology and how we can all capitalize on it. Stage is yours, gentlemen.
Very good afternoon, everyone. Very pleased to have this august audience in one single form. It's kind of an adrenaline moment for me, but I am not very sure whether I'll do justice to this moderation. But I'm definitely going to enjoy, cherish, and learn from this discussion in next 45 minutes. Healthcare. I think this is one of the two subjects, healthcare and education, which was kind of a dream for our forefathers, including Mahatma Gandhi, when we got independence. And I think the whole mission was to have healthcare for all. So, over the last 75 years, healthcare have evolved in multiple forums, multiple phases, multiple shapes. But I think the common goal was AAA, affordable, accessible, and all. We were looking into this. Whether we were able to achieve that goal or not is a secondary story. But I think suddenly connected hospital concept came into picture, NDHM came into picture. So Dr. Vijay, my question to you is that, when we talk about connected hospitals, why it is so important and how it will help us to revolutionize the healthcare, which probably we have not been able to do it in the last 75 years. So your view, Dr. Vijay.
Sure. Thanks, Rajiv. We've been seeing the industry shape and you've had your share in it. And first of all, I wish to appreciate you for bringing some initiatives. I really like the way you put things in it. What we are really visualizing, Rajiv, if you had to just go 30,000 feet above, creating this connected hospital creates infrastructure as a platform. So in some sense, that gives you two benefits. One, it re-engineers your point of care. So your hospital is no more a point of delivery. The moment you get your data, you can move it, treat it from home, treat a patient from home, help doctor decide on the cloud what should be the line of treatment for a patient. And we saw during this COVID days how vital it was, where close to 2 million people were treated at home. So that's the first benefit. The second is it refocuses on point of attention. And the point of attention now becomes the health seeker, patient, customer, whatever we call. The reason is you put the data to the person, you have that ability to then take an informed decision. And it means a lot. It saves lives because one needs to have his or her own data. Like today, even a simple access to SpO2 levels tells you when to go to hospital. You don't have to really rely on, a third indicator to walk into a hospital to know it, right? So that's the two pieces, Rajiv, that I clearly see. The moment you put this infrastructure as a platform, you're able to leverage a lot in terms of reaching more points of care to deliver, and you're able to give that attention to the health seeker. And eventually, we're talking about universal coverage, right? It's about covering your needs as an end consumer or a patient. It's about my preventive needs. I may be a smoker wanting to have preventive programs rolled out for me, as opposed to me getting admitted to cancer treatment, right? So in a way, it empowers all of us to start looking at our life a lot more closer with a very sharp focus on health. And it does bring in, a lot. So to your point, it creates a hospital to be two things now. It makes it like an air traffic command center, which helps control so many patients' lives at the facility and beyond. That's one. The second, it creates a cloud where we all can go and seek help. So if I want a doctor support, I just get into your portal, and immediately invoke a consultation request. If I need to be triaged virtually, I get the support of being triaged virtually. So in a way, the best part of connected hospital, I think you rightly put it, Rajiv, it's not about technology alone. It's not about the fanciness associated with digital. It's about it being enabling you to do two jobs now. That's the overall lens, Rajiv.
Very well said, Dr. Vijay, and I'm going to pick this and probably going to leverage it even in the future. You mentioned very rightly that this is infra as a platform, and care away from the hospital is the need of the hour, and empowering patient to, as we have mobile portability couple of years back, and we were not a captive of one particular service provider. Similarly, when you have the power of your own health vitals, you have the power to change your hospital, you have the power to change your doctor, and which is very, very important. Very rightly put. So, Shubhankar, next question to you is that, when we talk about, empowering patient and ability to have him move his vitals or records or EMR from one hospital or one care provider to another one, interoperability and data standardization is very, very important. And, if you really say it's a basic foundation of any connected healthcare service system. Now, it is very, very daunting task. It is not easy. But at the same time, when we have standards like ICD, DRL, SNOMED, DICOM, they are there, okay, which are respective platform standards. And then you talk about interoperability. You have HL7, you have FHIR, you have CDAC, CDA. So all of these are there. They have been there in the ecosystem for a fairly long period. They have been matured. We all ourselves have implemented them, HL7 and FHIR. Now, so these are there, we know it. So where is the challenge? Why still we are not able to reach a basic standard of information exchange between two large care providers? We'll talk about rural, urban divide bit later, but let's talk about 5 hospitals in any typical urban cities in India, and we still don't exchange information. Why?
Thanks, Rajit. Thanks. I must echo with Dr. Vijay. Just he told me that it is not a problem of technology. It's a problem of something process and some policies and some enforcement is there. Yeah, we talked about different standardizations in terms of patients' diagnostic data, patients' data. But main challenge is developing a standardized way of identifying a patient in different organizations. How you identify patients? Your patient UHID is varies from organization to organizations, even inter units of a particular organizations. So organizations like CHIM and HIMSS also, they are also pushing for the development of a national patient identifier also. They're suggesting different kind of how Shubhankar as a patient in India, Shubhankar as a patient in a particular ecosystems, healthcare ecosystem, standard ecosystem. So this is a big challenge for our healthcare industry. Not only the healthcare data, it's how Shubhankar is Shubhankar, so that matching the correct individual to his or her health data is critical to their medical care, obviously. So this is the main challenge I have seen last couple of years. And second is like, obviously, as Dr. Vijay told, that technology is not the alone. Enforcing health IT interoperability standards across care settings and facility. This is a big challenge for us also. Every hospitals, every organizations, they have to be enforced how they will operate. After EHR, you can segregate your patient operating systems and you can segregate from patient data, which will be common for all organizations. So you have to divide your patient care data into two parts. One is patient operating system, how your organization, your business is operates, and second is your patient data, how this data will be collated with other organizations also. So EHR is the layer where we can join this data. So enforcing health IT interoperability standard across care settings, we have to ensure that EHR data should be standard in other sense. And ending information blocking and data sharing impediments. Still, we have some sort of psychology that this is our data. It's not like it's a patient data. We have to get out from the this psychology. So information blocking is widespread now. No national policy put in place that you can't block these informations. So we have to see on that part. And as I told, definitely standard EHR should be EHR technology should be there across all the organizations. And another things Dr. Vijay told, infrastructure as a platform, it's a very good solution also. In that case, standardizations of infra will be can be established, and standardization in different HIS product. You have to go through some protocols whenever you are developing HIS and to implement HIS in some organizations, in some healthcare organizations. You have to follow that. So these are the things which I foresee that these are the main challenges, and this can be definitely overcome. In different technologies are already coming, like blockchain and machine learning things are coming. Even I am also facing this kind of same challenges in our merger processes also, because there are two big organization merged. So I am also facing the same problems. There are huge chunk of patients sitting in two organizations. So this is the same challenges I am facing. I just shared with you.
Great. Many thanks, Shankar. I think, you said it that how do we identify a patient? Basically, patient identification is very important. And if you look into the NDHM, one of the 6 block is health ID, which is equivalent to Aadhaar, ID. And I also like patient operating system. You use the word patient operating system, which is how patient as a whole, in terms of his vitals, in terms of other information carry from one platform to another platform. These are some of the daunting tasks which we have to address. So taking to the next level, Neil, Shankar definitely mentioned about some of the issues which we have, and these are not purely tech challenges. Everybody knows that tech is not a challenge because some of the standards, interoperability, and respective standards are in place for more than a decade now. So what, according to you, when a lot of people have been able to do it successfully across the world, mostly in the developed nations, are the challenges in India for corporate health settings?
Sure. Thank you, Rajiv, and thank you, Shankar, for sharing the challenges. Before I address the task in the corporate health settings, I would say the two major reasons what I've continuously seen is that technology is not less, in a sense, like technology is everywhere. Yesterday I was reading one report from McKinsey and Company, and it stated that every minute there are 25 digital apps getting uploaded on the App Store. So think about it, how many young innovators, scientists are coming together to provide cost-effective or care-effective solutions to the common people, especially all the population across the world. So the two major challenges is, number one is adoption, that those are not getting adopted, and there is a whole spectrum where we can dive deeper into it, maybe not in this kind of the conference panel, but in the next one. And the second one is the culture. What is the incentive that the particular domain or the particular department is going to get? We always tie incentives with financial incentives, but it not necessarily is always that one. There is much more beyond that. What kind of professional or personal growth that group or that organization or even an individual employee is looking for to bring about that change into that ecosystem, whether it's a closed ecosystem or an open ecosystem. And now coming to the corporate health settings, the very first important challenge, at Adani Group, which we are facing is uniformity in healthcare offerings. We have employees at the corporate health office here in Ahmedabad, Gujarat, where they have the state-of-the-art accessible healthcare 24/7. But when you look about the remotest location, the greenfield projects which the company is starting to bring about a positive ecosystem change, in Odisha, in Maharashtra, in Tamil Nadu, in Andhra Pradesh, there you cannot even walk to the location. So now how you provide, the primary healthcare to those employees? What is their incentive to be a part of the group? So that is tying up with the challenges what the group is facing. The second one is the business continuity process. As we all know, COVID happened last year, and suddenly everyone started working remotely. So how you can take a mammoth workforce and make sure that they are safe and well and still able to contribute to the projects which they are part of. So launching some initiatives like telemedicine, and again, as a technocrat or as an IT person or a technology leader in healthcare, you can bring about the best telemedicine platform, even from US, Australia, India, anywhere. Right. But now, what are the next steps in terms of, not only just in terms of implementation, but again, making sure that the employees are using on a daily basis. Now, not only just the employees are using, you also have to have a healthcare workforce who are trained enough to ensure that there is that connectivity. And on the top of it, the follow-ups, maybe on a weekly basis, maybe on a monthly basis, to see that whether, that positive health change is taking place. And finally, all about the wellness initiatives, how a corporate group is able to not only invest but also allocate resources so that employees feels at home and making sure that they have been taken care of. And now, not only the post COVID or the new norm, everyone wants to feel connected, and it goes back to that connected healthcare ecosystem which you are talking about. I only talked about the employees in a general, but if we are able to do and replicate the same thing for our patient population, at all these major hospitals which you are part of, that will be a game changing scenario.
Very well said, Neil. You mentioned, rightly that challenges are always, and Shwankar also mentioned, challenges are on the cultural side. What is in it for me? Not just purely financial part, but professionalism. That zeal which is there in us, that this is what we want to do, the sense of achievement, and adoption. You said it rightly. So, Neeraj, next is that adoption. At one time, you're talking about we have a struggle with the basic car, and other stuff we are saying that let's go to Mars in a space. So I just want to ask you that there are enough challenges in adoption of EMR, and unless we have an EMR in place, it's a basic system of records. We can't think of going to the next level like IoT, big data, connected device, AI. So I just want to ask you that, knowing that there is a challenge on one side, which all the speaker, Shwankar, Neil, Dr. Vijay mentioned about challenge with respect to EMR. Okay, and we all know that how difficult it is to have EMR implemented in most of the organization. It is not about tech; it is about cultural aspect, which Neil also mentioned. So, want to hear from you that nation wants to move towards the next orbit, which is AI, big data, IoT, and we are struggling with records.
Yeah, thanks, Rajiv, for this one. See, I'll just tell you my practical experiences. I am not from the IT background. We run hospitals, PNL, and all. So, what I feel, if you attach PNL to the doctors, because I think doctors these are business people now. So, my experience in Ahmedabad, Bangalore, and not Hyderabad, we run hospitals in 3 states. Andhra, Telangana, as well as Maharashtra. So I'll give you an example of Bangalore, which is the most tech cities, and I think doctors are also quite friendly with this thing. So we run a children, mother and child hospitals, and it is very, very difficult to ask them to use EMR. In fact, we have taken physician assistants to help them while they are on the rounds to do that, gynecologists and pediatricians and so on. And it has been seen, when I was there, just 5% of the total EMR, the compliance was there. Every month I used to make a report, call the doctors. Apart from their talking about their MGs and the business, what they did, I also show them how much obs gynecologist number 1 did and all. So, see, I feel if you keep on communicating with them, see, I'll give you an example. Like we got a 5 full-time gynecologist was there, and the gynecologist which is doing maximum number of cases, her compliance is 0. The gynecologist which is doing only few deliveries and cases, she's doing 70%, 80% compliance. So I think the problem is volume and doctor acceptance. See, say for example, I send an IT manager or a EMR guy to them. So they have to flip around so many pages to come to give a prescription to a doctors. So then what we started, which my past experience also says, okay, if you are doing a EMR, it will help to increase your business. Say for example, if you're doing EMR, our call center will able to call your patients, number one. They will go down and collect the prescription from your pharmacy. So total bill, say for example, I have seen, 30%, 35% people just don't take pharmacy from our hospital pharmacy chain. So the prescription is not given to the patients. So we are asking the doctors, while you do a e-prescription, while EMR in OPD, your patient is supposed to collect the prescription from the pharmacy. A care manager will take down the patient to the pharmacy and a prescription generated there with the medicine. So these things help. See, I feel people always blame doctors, but I feel if we involve them in the process, because I feel there is a gap bridging between the doctors. And I think these CEOs and the business managers, they talk only business to them. So if you use the business angle, and I think I've seen the compliance in Bangalore from 5%, which has reached to 27%. In my current hospital now, if you see, which is a multi-specialty hospital, Vizag compliance is better than Hyderabad. Some of the specialties like cardiology, out of 8 major cardiologists, 3 follow in a great way. So one day in one of the morning presentation, I was talking to them. Okay, this Dr. X cardiologist is getting more patients from this part of city because of his EMR compliance. And then suddenly I've seen a change in the culture in cardiology. So I feel, if we connect with the doctors, explain them, and it is a gradual process. You will not have an implementation just like that. So like, because we are changing the culture, a different workflow for the physician is there. So they are documenting more information than the past. Earlier, if you see the prescription, it is few sentences. Now they have to write. And some of the patient also complained. While the doctor interaction with the patient is getting down and seeing on the screen is more. So if I am a doctor, if I am talking to the patient, so patient feel comfortable, her satisfaction goes up. But while I'm talking to the patient and doing something on my laptop or a computer, to feel doctor not talking to us, I'm talking from patient satisfaction level, which I have seen. So these are the few things which I have seen. And apart from internet and hardware issues, cloud storage, the cost, the vulnerability, these are there. And I feel the bandwidth of an IT team also. See, if you see the IT managers, see, my personal experience I'm talking about, I'm not talking about people, the bandwidth is not there. A system is procured by certain people. Doctors are not part of these people, and IT manager have to go there and teach them. I've gone to that level. I've asked them, take a training of the doctor by going to the consultation room and show me a presence, whether they've learned or not, to that level. And I have seen here, thankfully, we are doing around 38% of compliance in the EMR. And you take a big star doctor from one hospital who is very senior in the term of number of year of experience and all, it's very, very difficult, to do that. So I'm talking to these people. If we can involve certain thing, you can increase the business by using EMR. Medical legal is one part of it. But if you talk about the EMR compliance, the business, say for example, EDD data, when the follow-up has to be done, and when you pay them from the total bill, whatever, the pharmacy cost also come into place. So all those things, when you use these jargons, I think doctor will able to use it, and doctor is a key stakeholder in this entire EMR compliance process. And interoperability. See, we have a hospital, we have 17 hospitals. So data from one center to another center. These are the challenges which I have seen. So that is my personal practical observation while implementing EMR in hospitals.
I think very, very, very practical and very, very pragmatic views, Neeraj. I think you said it right that you have to involve them. You have to, that's what the culture and that's what Neil also mentioned about what is in it for me. And they will also understand the nuisance of why it is important and why it is, critical for their own benefit as well as for the benefit of the enterprise. So very well said. Now, Dr. Vijay, the next question to you is on this. We all understand that connected hospital is the future for the nation. Now, one of the whenever we say connected, it means internet. Okay, so internet penetration is one of the prerequisites. Now, coming back to the internet penetration, we have roughly 300 plus ISPs in the country and less than 10% broadband penetration. I'm not talking about dongle and other stuff. Broadband is less than 10%. This is from a ministry report, very recent report. On top of that, we have an urban and rural divide, which is a digital divide, and then poor internet penetration. So, how such a massive, mammoth mission of smart hospitals can be executed? Are we setting a right goal for ourselves when we have a severe shortage of other priorities which are not yet addressed in the healthcare sectors? I mean, ultimate aim, whether internet, smart, connected hospitals, or doctor-patient ratio, is these are all means, but ultimate is that we should be able to achieve universal health coverage for each and every one, which is the dream of the founders of the nation, including Mahatma Gandhi.
So Rajiv, it's a valid question. Before I have two parts to that, right? Chasing massive dreams. The first part is you need to have the ability to talk the language and communicate what you're going to achieve as results to the stakeholders. And like Neeraj rightly put it, the core stakeholders need to know why we are doing what we are doing. And that's very important. And the language matters a lot, and how you are able to communicate that, because that brings in diversity to problem solve. So you bring in more stakeholders to visualize something big. And since you touched space, Rajiv, I just want to say that today we can take a kilo load from Earth and put it on outer space, basically losing gravity at $2,000, which is basically 20 times lesser than what we used to do with NASA. So it's a matter of dreaming and possibly visualizing what is the benefit of doing it. And it's not about carrying a kg, but it's about what it changes to the Earth. It's about putting in all those imagery. It's about tracking that COVID case and that last mile we are not able to reach. So there needs to be a very clear visualization of what is the achievement or end state goal that we want to achieve at different stakeholders. So if we get that right, Raji, then it's about putting in the process, whether you're hacking time, system, process, being very methodical. And one illusion, Rajiv, when it comes to digital, right, is about broadband data limits. I have two different examples to talk to you where there's only 10 kilobyte per second data available, and yet very successful programs. So if you take a country like Mongolia, right, they just have 4 million people, and they have health services made available to last mile by just communicating with mobile phone, SMS methods. So you're talking about what the power of digital is for a last mile beneficiary. And they also dreamt that, of course, they were in a state of adversity that they had no option but to build something of this kind. But it's doable. The second example I want to take, Rajiv, is take a country like Zimbabwe. They are 1/3 of our GDP per capita, and they currently maintain essential health services by using real-time data. So, like the way we're talking about COVID vaccine given, updated. A other vaccine given, updated. An intervention done for birthing, delivery, updated. So the point is, these two countries give you a very clear cue or a precedence that it's about how we reimagine and really make it happen. And I'm not talking these two countries. I've seen Neeraj. I think his examples were very valid in terms of talking to the doctors. I've seen Rajiv. I've seen some of your work fly beyond Medanta. For example, computer on wheels. I'm sure it's a 3-4 year old concept that you had, but it's so well executed that today a doctor sees a computer with him and he's able to access the data that he or she wants at the time of the bedside, right? So some of these need that ability to visualize, implement, bring those stakeholders, and achieve. And I'm not talking very utopian. We are already doing it. By the glimpse of it, India served and treated about 3 million patients, 3 crore patients this COVID, of whom nearly 2 crore of them were either directly or indirectly treated at homes. So we see the results that we're already able to take massive dreams and turn them around. It needs stakeholders to come together and make it happen. And yes, to Neeraj's point, it needs that ability to be brought to different stakeholders in terms of what I'm creating as a value.
Excellent, Dr. Vijay. I think everything boils down to basics. Communicate, communicate, communicate. And you rightly said that we have to think big. It leads me to that big, hairy, audacious goals, when we set for ourselves, that big, hairy, audacious goals. So, Shovankar, we all understand that these are all big goals and we have to achieve because there is no other alternative. Now, to achieve these big, hairy, audacious goals, especially when you talk about volume, and Dr. Vijay took an example of Mongolia. I could have never, realized that Mongolia, with such a low capability, or not so visible country, has been able to achieve such a low bandwidth. So, a country of 1.3 billion people, such large volume of data, and definitely there is a serious concern with respect to information security. Seen frauds happening even in the initial days of Ayushman Bharat. So, what's your view that how do we, measure this, sensitivity, and how do we control this information frauds in the healthcare sector? Sorry, Shovankar. Shovankar, you're on mute.
Yeah. No, I think I am audible, right? Rajiv, I am audible? Yeah.
Yes, Shavankar, you are.
Yeah. So I just take a reference of what Neil told, McKinsey's reports, I think every day 25 new healthcare app developing, right? This is the data.
Yes,
Right.
that is correct.
So you can imagine how many technology is available in the market, and as Neeraj also told that poor IT knowledge can trouble you. That is also a concern. So there is a lot of possibility of your systems, and there are a lot of lackness of the knowledge of the IT systems deployed in a particular organizations. Yeah, so we have to match somewhere how we can ensure that whatever IT is recommending in an organization, that you should apply this kind of tools here, this kind of systems, so that you can get the maximum benefit in terms of business, in terms of your data, in terms of security. So yeah, there are certain protocols, certain audit systems are there. Before putting any systems, you need to audit those systems. Even each audit should be a periodic activity for any organizations, and it should be honest audit. It should not be like eye wash kind of audit, just for the sake we did audit and it is an auditing report. And the action taken from top, they should monitor how IT systems is taking the actions against those audit output even. So when two organizations are getting merged, there are certain auditing requirement is there, I can mention VAPT kind of things, threat hunting kind of things are there when you are accessing one's environment from the other. So when you are accessing, it's I am talking about only your internal units, internal systems only. I'm not going outside of my system even. So when I'm talking from a particular unit to the other unit, there is a 99% chance of vulnerability in between. So you are traveling like an open air. Now you have heard about Pegasus. It's a hot topic going on in the country. So you are not secured. Definitely you are not secured. But try to secure maximum. It's definite. So whenever you are applying any systems in your organization, you need to be secured in great extent. Your IT systems must adhere those security systems first before applying any kind of new technology in your organization, in your environment. This is compulsory. I think Rajiv, Mr. Samar. So how, Dr. Vijay, you are an auditing firm also, how you are recommending in this?
No, I think it's a valid point in terms of stitching together compliance, tables, people, all that is part of how we go about it. And I think from I've heard you, I've heard Neeraj, it's pretty evident that we need to get the act right, thought right, and think from implementation lens, right? The impediment is the state of mind that if we have a mind to make it happen, we'll make it happen. If we are sitting behind and thinking about it, how to leverage NDHM, what is the relevance of it, we'll never get to that point, right? Rather look at the upside of it and build something on top. Then you see the benefits there.
Right. And
so maybe I move on to the question until we have Rajiv and Neil.
Neil, you can extend your experience on this security aspect also.
Sure. So thank you for asking that. In terms of the security, I would say one thing, which is a real example which I went through last year. So suddenly overnight, all of our employees started working remotely. And, as all of us know that Adani being heavily dependent on the physical infrastructure, as a corporate, we never focus on the business continuity process or, none of the employees ever worked from home. Those kind of concepts are there, especially in the IT or the technology industry, but not in the heavy, physical infra industries. So the moment we decided that we'll need a telemedicine solution and a connected ecosystem where we are able to engage and connect with our employees while they are, hundreds of kilometers or even thousands of kilometers away, we order. Yes, Sunny. Okay.
No, continue.
Okay.
Yeah, we can continue. We have a question with me also.
Okay.
Yeah.
Sure. So we brought about, a particular solution partner. They are one of the heavy presence, telemedicine EHR platform solution provider out in US, and we wanted to bring the very best. So the moment we said yes, we'll go ahead with that, the two major questions came. One, it's a US based company, whether they will be able to meet the Indian standards in terms of healthcare delivery. First of all, whether our doctors will be able to utilize that solution in a proper manner. And coming to Suvanka's question in terms of the security, now our chief informatics security officer, coming from that position, the very first question was why we should share our employees' data to a third-party solution provider.
Yes,
correct?
Yeah.
So now, are you just focusing on making sure that the data doesn't go to another solution provider, or are you more focused on providing the most urgent healthcare need to solve the problems of your employees? Right. So it's an ethical question. And the best solution for about is to bring each and every stakeholder. So it was a 1 month mammoth task where we got the entire CSO organization coming together, the telemedicine solution provider, our doctors together, and us from the technology side, and coming together and finding a viability solution where we can start taking the first step and then taking the second step. So now we are at that 100th step where it is completely integrated with our Adani ecosystem. But if you would have not taken that step, if you would not have brought that stakeholder together and address their concerns, addressing concern is the very most important challenge that you have to go through. Because if you appease your management, if you appease the group with which you are working on, you will have a larger and global presence as the months and the years goes by. So addressing the security question is always an important thing. You cannot have shortcuts, you cannot have whitewash, you cannot have, okay, let's just do it now and then we'll take care of it later on. Because when you are working for a global company, all the ransomware attacks and all other nuances are always there. The DDoS attacks are always there on a daily basis. And then it's also about the credibility and ensuring that, just like in US, you take care of the HIPAA compliance, you take care of the clinical clearance, you ensure the same thing over here and make that possible.
Yeah,
thanks, Neil. In terms of in terms of the sensitivities you spoke about, I think the biggest sensitivity is that patient data and the sensitivity around that, right? So I want to take this question to Neeraj straight away because he's been at the forefront. Spoke a lot about. So there are a lot of sensitivities and stigmas attached to patient health records, and it is known to us. And there is a significant risk of expanding more data and exposing that, right? From that perspective, Neeraj, there's always an assumption that there are a lot of pitfalls in digitization when it comes to consumer health seeker data. What has been your experience? And maybe I want to add this to Shubhankar later on. How easy it is to ensure that you're able to protect it.
See, you're very right. See, I was seeing one data in the year 2020, the number of individuals which is affected by healthcare data breaches were around 2000 plus, and out of which healthcare industry is 536. So it is a big time number. And if you see 1500 COVID-19 lab tests were hacked from the government websites, and the leak information, patient names, the date of birth, the testing dates, and so on. And there was some firefight. There was some company, they told hackers have stole around 68 lakhs patient and doctors data from the healthcare website based out of India, and record were being sold on the dark web. So that is the status of healthcare data, which is going here and there. And a few days back, some company came and they're talking about they got a very good module there out of US, and patient engagement once the patient leave the hospital. So since we got our own home healthcare vertical, so I told okay, we are not doing, we take care of patient very well. So I feel data has healthcare data is very, very sensitive, and everybody, so many people come and approach. It is very, very easy to take this data. So what I feel, the ways to suggest ways to minimize that, educate personal and security staff, routine risk assessment, access control. I've seen anybody can go to the server rooms anywhere. You call one staff nurse, you just give a try and say Mr. XYZ is admitted in the hospital, what surgery he's going for, what is the billing guy will tell the bill, what surgery. So it is very, very, you just call any big time hospital. I'm not talking about small time hospital at all. You go to the patient floors, the patient name, the age, the phone number is said written. However, the quality practice showed, don't write the patient name. If I'm getting you some treatment and somebody come on the floor and say my name and this surgery, you are breaching the data. So healthcare every day, I think hospitals is a like panwala shop. Anybody can come, take anything and go away. There's no rule. So I think there should be sufficient ways and means to protect the data, which is not happening at all. Role-based access, what we do in billing, like Active Directory implementation. I'm talking about smallest thing, like one of the hospitals I've seen, good hospital, there is no Active Directory. They told there is no budget. All those things are there. So I think healthcare data is very, very important because it is a patient data, confidential data. So having said, so I think some IT managers and IT heads need to think about that. But what I feel, education is the key. We have to understand what data has, how can it be used. You call some like digital team, okay, I want 5 lakh data, like we were doing COVID vaccination and COVID. So I can see, my digital head can see the vaccination given by all the hospital doses 1. So people are calling, okay, you can come here for dose 2. So data is easily available. So I feel some check and some security management tools should be involved so that we feel that this data is important. I think most of the healthcare people don't know why this data is very important. They know sensitive. So sensitization and education, personal and security best practices is a key thing in order to have social stigmas which is access to the pitfall for digitization of health records. That's for me.
Shwaka, one question to you on that associated question. How do you encrypt and how do you safeguard so that, as part of it, like what Neeraj really opened up a whole lot of loss of leak of data, which is sensitive for sure. But what has been your approach to holding that?
Yeah, I just quickly conclude. Basically, I think we are. I think Sunny, we have some 2 minutes more. 2 minutes?
2 minutes is good.
Yeah. So I'm a little bit. You can say I'm a little differ from what Neeraj told. Basically, being an organization, we should help even clinical research part also. So data sharing, it's should be in a structured way, not in an unstructured way. So there should have some certain understanding with some clinical research companies where we have to share this. Otherwise, we can't build algorithm, we can't build technology which is coming next 5 years. So we have to help in that area. So our data sharing should be there, but in a very structured way, I must say. So definitely there should have patient privacy, patients' rights we have to maintain, but data sharing should be there.
Sunny, do we have do we get back to the questions, or how do we have some time for that?
Yes, we have about 2 or 3 minutes. Sure, no problem. We want to make it interactive, so by all means, go ahead.
Yes. That sounds good. So I've got one interesting question on what are the first things we should do when we talk about going into smart hospitals? What's the first immediate thing that we should do tomorrow? And fortunately, we have a provider. We have Neil who's talking about corporate wellness. We have Shankar who's helping us connect the dots. Maybe we take a round on what is the immediate thing you will do tomorrow to move one step closer to smart hospitals. Maybe we start from Neil.
Sure. Thank you. I would say the very first thing you have to focus on creating a smart ecosystem is creation of a unique identifier. Okay, be it your patient, be it your employee, be it any of your stakeholders, even the vendor partners which you have. So the moment you have a unique identifier, you are able to trace the data based on the transaction, based on the outcomes, also based on the performance which they are delivering. Okay, so and it creates the de-identification of that individual or the group identity also, which Mr. Subankar talked about, right? And also Mr. Neeraj talked about. So the moment you have that unique ID and then you de-identify that with those individual names or the group identities, you are able to create a good ecosystem where you take care of the patient privacy, data security, and also making sure that you are empowering the group as an overall identity. So that's from my end.
Your thoughts? What would you do next to get closer to smart hospitals?
Yeah, I must say, being a first step for smart hospital is like to give all patient data to the patient. This is the first step you have to. Every hospital give all the data to the patients. If once you have done this, then your hospital is smart. Next, you can go gradually. You can develop gradually.
That's very, very interesting way to start the game. Neeraj, to you?
See, what I feel whenever patient enter the hospital, he come with a big bag with all the reports, a pathology report, a CT scan reports and everything, carrying all X-ray films and all. I'm talking broadly. I'm not talking about only just corporate hospitals. So if a patient enter to a small clinic or a hospital, if some card is there or some unique ID, what Neil is talking about in Shubhankar, so a doctor can see all the reports. See, sometimes it is very, very difficult to see hard copies, which is first your sugar level and what is now. So if a single platform is there where a past reports and a current report is seen, based on which he give a medication and a treatment. So I feel a patient should not go from one place to another place carrying the reports. Generally, all the senior citizens, whenever they come, they keep all the report in a very structured way. And whenever you go to a doctor, they show. So I feel a smart hospital mean I should go just like that. Just walk into a consultation room with all registration process, and I can go to a doctor. Doctor can just log on my unique ID and show all my report, based on which a treatment can be initiated. So that is what I feel a paperless hospital.
So back to you, Sunny. I think it's been wonderful. It's more about united by how we can reimagine the possibilities, right? You saw it. There's no difference in terms of how we weave this solutioning around. And the best part, Sunny, was I think this panel was all about patient and the person at the heart of it. It never spoke about anything beyond, and never spoke about digital technology, gigabytes. It spoke about doctor, it spoke about patient, it spoke about how system benefits. So it's been amazing and wonderful to have Rajiv set it up for us. I think he set the context beautifully well, and then we've gone. So back to you, Sunny, for this.
Thank you very much.
Thank you.
It's a pleasure seeing you and meeting you on this platform. Thanks, Sunny.
Thank you, Sunny.
Thank you, Sunny.
Thank you, Neeraj. Thank you very much. Shiv Kumar, thank you.
Bye.
And Vijay, thank you very much. See you all gentlemen backstage.
Bye-bye.
Bye-bye.